I've been in 4 districts, and what a wonderful place that has great values, supportive to the school district, supportive as a to our children. And so I wanted to start off by just saying thank you. We appreciate your patience as we posted yesterday. The in all of my time, this is the hardest, the most challenging piece that I've ever dealt with. And we've got a great team. We've got a great staff that I know that we will get through this. So we've got a supportive community. So we thank you for your partnership and your continued efforts. We please continue to share your prayers and thoughts and ideas as well as we navigate through these uncharted waters. Again, I thought that was important to share out. We have this scheduled for a couple hours, and we had a similar presentation this morning with our staff. And so it truly is going to probably take that 2 hours. We exceeded the 2 hours, so we're here as long as you want us to be here. But let us start with some protocols. So I'm guessing most of you have been in a Zoom meeting now because yes.
Just real quick, just so everybody on the call knows, we are recording this, so it can be posted later on to Facebook for those people that can't be here, but I just wanted everybody to know that it is being recorded this evening.
Thank you. I appreciate that, Jennifer, and that's our board president, for those of you who might not know, but I'm guessing most of you do. So with Zoom and with so many folks on the meeting, please assist us. We have that chat feature, and we'll be looking at that chat feature, but post your questions there. We will stop in spots to have you be able to unmute yourself, and we'll have a process there. I'm going to have Mr. Webster, our elementary principal, kind of lead that process, and so that you are able to ask your own questions in your own way. During the presentation, please mute yourself as if we get background noise, it's distracting, and it takes away from everybody truly hearing the message. We again will have that Q&A, and this is a biggie. So we're not here. We all may have differing opinions on the topic of COVID-19, but we're not here to debate that topic. We are the safety and well-being of our staff and students are of the utmost importance, and you will see protocols in place that will assure that we are taking that extremely serious. And so again, we'll share those out. And as always, and I really don't need to go there because again, this is a wonderful community, but let's honor people's comments and thoughts because again, we all may have differing opinions, but let's respect one another. All right, so we are here, and I think the health department will also kind of go there with us. So the governor put a Return to Learn a council together, and then they put a blueprint together to say, hey, school districts, you need to have they gave us some guidelines and requirements. And so that is at the essence, the Return to Learn. We shared the Return to Learn plan that the board will be looking at Monday. That's not really, it really doesn't impact instruction. It's 10 pages and it's all about protocols. So we've forwarded that. It will be on our website as well. But the board is not voting on an instructional model for us. Just want to make that clear for all. They're going to be voting on the state requirement, which really gets at the protocols of and more safety measures, safety and hygiene. So there are, and again, I'm just gonna, because I know the health department's gonna touch on this, there are 6 phases, and right now we're in phase 4. We'll elaborate on this a little later. So when we put this together, And someone cleaned this up really nice. I'm going to guess Matt. Thank you. No, okay, somebody did, but it's beautiful. Our mission and vision, values, beliefs. We are very strategic as an organization, and the strategic plan is really our foundation, and as we make decisions, and part of that are our belief statements and our values. And so on the left-hand column, you'll see some values that we've defined, and when looking at presenting, I just wanted to take a view. I went back to our one page, and I often do that when you see me presenting. What are we, in this work and dealing with this challenging piece of addressing this pandemic, how are we addressing our values? And these things at least spoke to me. We have to be compassionate to one another, and it's all about embracing that caring approach. We need to respect and be transparent, and that's what we always strive to be. Is share out as much as possible, and get folks to provide some input, and that's what you're doing here this evening. Learning. Learning's, especially under these conditions, very challenging times, and so we need to continue to grow, and we're asking a lot of our educators, we're asking a lot of ourselves in the way we do things. Being courageous, again, we're really taking on a challenge, a huge challenge, always pushing for excellence. We are Schoolcraft. We're not, another district. And I think a number of times people want to say, well, what about this district? What about that? We use that information, but we look, our model, and you will see it, it's unique. I mean, it's not one of these, again, we can pull from other things, but we're Schoolcraft. We're always pushing for excellence. Perseverance, again, these are tough times. We're going to fight through this together because we're all Eagles. Being innovative, again, we hope that the plan that we put in front of you as a proposal, and this is a proposal, it's not in stone, that you see that we spent some time and really are trying to capture and provide options for our families, and while also keeping our place safe. We believe, again, I'm not going to read all those, but we have to make this place safe, especially during these tough times. So I just wanted to share out some of our values and our beliefs as we go forward. Oh, let me go back. I apologize. So today's agenda. So we have Mary, and I've gotten to know Mary quite well of late. And she's with the health department, and Penny is one of the lead folks there as well. And they're going to, the next slide, they're going to take over and present about 20-30 minutes. And then we'll stop there and ask some questions related to health and our county. I think that it's extremely important that we know about this COVID-19 and the impact thereof, because and I'll say it, and I've said it before, I've got to lean on our health experts in making this decision. I certainly I'm disappointed that I have to make this decision as the superintendent of schools, but I feel very confident because we've got a great relationship with our health department and others, you as the families and the staff, and so we're going to make the most of it. But here I'm making a health decision, and I'm not a health expert, so I'll say it and won't say it again until, oh wow, I'm not sure what happened because my screen is.
Sorry, Rusty. Yeah, I shared my screen.
Oh. Oh, okay. Well, you know what? So everybody saw my agenda. Mary, you're gonna rock it out.
Okay. Good evening, everyone. I'm Mary Franks. I'm the epidemiologist at Kalamazoo County Health and Community Services, and I am going to go over some K through 12 specific data as it pertains to COVID-19, and also take you through another PowerPoint that the health department has, created for all kinds of audiences as it pertains to kids getting back to school and all the considerations that we want you all to take as the health department. So just a brief situational update for where we are in the state right now. So we have a total number of confirmed cases in Michigan at 84,707 with 6,221 deaths. For Kalamazoo County, we are looking at 1,473 cases with 81 deaths. And if you look at this graphical representation here, this is an epidemic curve. So this is the number of positive cases, new positive cases per day since the beginning of this pandemic. So you can see here on the left-hand side, on March 10, that was our first confirmed case. And we hit our major peak here towards, the end of April, early May. And then as you see, as it goes on over time, we were doing extremely well in terms of a low number of new cases, the end of May, early June. We have seen a slight spike after the state opened up, after the executive orders allowed some of those personal care services to open up. And we expected to see that spike, but really, it hasn't been nearly as dramatic of a spike as we saw in the beginning of the pandemic. And then you can see here, we've seen a decreasing trend in that 7-day moving average. That's the orange line there for about 3 weeks now. So, we're in a good position. We're seeing decreases. We are still seeing new cases, but, we're seeing a lower percent of positivity testing for all the tests that have been administered. So, we're moving towards, seeing fewer and fewer cases every day, which is fantastic. All right, moving on to Kalamazoo County cases. So these are all confirmed, laboratory confirmed COVID-19 cases. And these are all the cases in Kalamazoo County. And this is broken up by age group. You can see on the pie chart here. So we break these up. The age group that we're concerned about here, K through 12, is that 0 to 19 age group. And this is that light blue slice here. So you can see that 12% of cases in Kalamazoo County have occurred in adolescents under 19 years old. So as many of you may be aware, we did have a really significant outbreak at the Lakeside Academy, and that comprised of a lot of students in that 0 to 19 age group. So if we take that outbreak out of the equation, then 9% of cases in Kalamazoo County have occurred in adolescents under the age of 19. Moving on, these are Kalamazoo County COVID-19 deaths. So just a really important point here that we have not had any deaths occur in adolescents under the age of 19. And you can see here that a very small percentage, just over 5% of the deaths in Kalamazoo County have occurred under the age of 59. So we are really seeing that the mortality of this disease has burdened that older age group. If you can see here on the left side, nearly half of all of our deaths in the county have occurred in those 80 plus. So we're really seeing that mortality affect our older population. And also, of all of the deaths that we've seen, 75% of those have occurred in long-term care facilities. So unfortunately, this population is extremely vulnerable, and we've seen those deaths occur in those facilities. Moving on to Michigan cases. So these are all confirmed COVID-19 cases in Michigan by age group. Michigan does their age groups a little differently. They just broke this down a little differently just this week. So they do a 0 to 9-year-old age group and a 10 to 19-year-old age group. So you can see here, these two slices here are the 0 to 19 combined, and just over 7% of cases in Michigan have occurred in adolescents under 19 years old. Moving on to Michigan COVID-19 deaths. So this age group is the 0 to 19 here. So we can see, you can't even see the sliver here that's represented. So 0.1% of deaths have occurred in adolescents under the age of 19. So very few, less than 10. And, you know, if you look at the rest of the pie chart here, you're seeing that 98.5% of deaths have occurred in those aged 40 plus. So we're really seeing, like I said earlier, with the Kalamazoo County mortality, and as you'll see in the next couple slides, the United States mortality, that the burden is really on that older age group. Moving on to United States cases. So these are confirmed COVID-19 cases in the entire country. So the CDC breaks up their age groups a little differently here. So they do a 0 to 4-year-old age group and a 5 to 17-year-old age group. So you can see here, these two represent the 0 to 17 combined. We're seeing that less than 8% of all cases in the United States have occurred in adolescents under 17 years old. Moving on to mortality in the United States. So looking at these two age groups again, you can see that combined 0.2% of deaths have occurred, you know, in the 0 to 17-year-old age group. And then if you combine, you know, the age groups from 29 and under, we're seeing less than 1% of these deaths have occurred in people age 29 and younger. So as I said before, we're really seeing the trend here in Kalamazoo County, in the state, in the country, that the mortality burden is on the older population. Now I will move on to the next PowerPoint here. So this is something that the health department has developed for our schools, and we ask that you know, you don't disseminate this. We really want to be the ones to present it here, to give all the nuance and the context here. So this is just an overview of a lot of different things, all regarding returning to school. So this is the data update, which I just provided to you all. So moving on, so Rusty had mentioned the My Safe Start plan. So in Executive Order 2020-110, it just outlines that Kalamazoo County is in Region 3. That's a MERC region, and you can see here that it's, you know, the lower left-hand corner of our state. And the executive order also states that we are in phase 4 of the My Safe Start plan, which affects our schools and how we can reopen. So the My Safe Start plan, these are all the different phases 1 through 3, 4, 5, and 6. Right now we are in phase 4, so that is what we are focusing on. So for the virus status, it's, you know, the current phase that we're in, the number of new cases has fallen, but overall cases are still a little higher. And as for the school operating, you know, in-person instruction is permitted with required safety protocols. So moving on to Executive Order 2020-142. This is the executive order that dictates that all of the schools must come up with a COVID-19 preparedness and response plan, and laying out how they are going to cope with the disease across all the various phases. And it just lists a couple of key dates here, so I don't need to go over these, but just saying that, you know, they have to have this plan and it needs to be tailored to each district. And we just want to emphasize that, you know, this isn't a one-size-fits-all solution. Just as Rusty said, you know, each district is different, and you all have different communities and different considerations and different buildings and different classrooms, and, you know, it's it's not a one size fit all, and you know, we're going to tailor that to the community's needs, and the health department is here to help every, you know, every jurisdiction, you know, return to school safely. So in the My Safe Start plan, all schools are allowed to resume in-person instruction in phase 4. So if we do see a huge increase in cases, we may see that those phases shift backwards through 1 through 3, and we'll deal with that there. But phase 5 and 6 are really just going to relax the rules. So we're just focusing on phase 4 here, which is what we are in. And just a note that the schools have the authority to enact stricter public health requirements than mandated in this roadmap that's laid out. And they have the authority to close school buildings even if they have not been mandated to do so. So we will be working closely with all the districts to make sure that we are monitoring what's going on, and we'll be consulting with them if the unfortunate occurrence arises where we need to do that. So this is the roadmap, is the document that the state of Michigan put out, and these are just links to all the different requirements. It links right to that page in the PDF document. So these are just all of the different requirements that the district is having to contend with. So you can definitely reference the roadmap here and see what is required of your school and district. Next, moving on, I want to talk about risk in school settings. So in general, as you know, I went over the data, older adults are really the ones who are being affected, but we also have to consider the general population. So people who have severe underlying chronic medical conditions, heart disease, lung disease, diabetes, things like that, tend to be at a higher risk for developing more serious complications from COVID-19 illness, and quite honestly, other illnesses as well. So we just want you to take that in consideration, you know, whether you're a school employee or, you know, a parent or a guardian, that your risk is heightened. So although this pandemic has only lasted, you know, seven-ish months, we are finding that typically COVID-19 is less severe in kids. There's a less severe disease presentation, but we are seeing, you know, even children with comorbidities or different diseases are at a higher risk of severe illness. And we have seen that children are less likely to develop symptoms than adults. So it's really important to do the following things that I'm going to lay out next to help mitigate that risk, given that, you know, kids can be asymptomatic carriers. So some of the risks in school settings. So, you know, everyone understands that the more people a student or staff member interacts with, the longer the interaction, the higher the risk of spreading COVID-19. So cohorting is just a fancy word for grouping students together. So what we're wanting districts to consider is to group these students together in, you know, smaller group settings so that we can limit how many students and teachers will be exposed should someone be contagious. So there's lots of different factors that go into someone's risk. So the intensity of the exposure. So were both parties wearing masks? That affects the risk. The frequency of exposure. So how often are you seeing someone? The duration of exposure. So how long of a time did you spend with an infectious person, excuse me? And then, you know, your personal health as well, as I went over, also affects this, and the age of the parties also is a risk factor here. Moving on to how COVID-19 spreads. So there's 3 ways that it can spread, and I'll start with the most likely in droplets and move to the least likely mode of transmission. So respiratory droplets enter the air when an infected person coughs, they sneeze, or they talk. And it can also be spread directly, for example, like kissing or sharing personal items. and this is the most likely way of transmission. Moving on to slightly less likely way is aerosols. So these are similar to droplets, and they're created when we breathe, we talk, sing, sneeze, cough, all of those things. They are lighter and they can stay in the air longer than the droplets, but they tend to go away quicker. And lastly, COVID-19 can be spread through objects when droplets or aerosols settle on them, although we're seeing that this is not the most likely mode of transmission. Moving on to that, this is just an infographic of transmission and the highest risk. So, you know, the person here, the purple person here on the left is represented as an asymptomatic COVID-19 carrier compared to the uninfected person. So I'm sure we all know by now the highest risk is if you are, both parties are not wearing a mask and you're not separated with that social distance of about 6 feet. And then, you know, you move on, and the low risk is if you're both wearing a mask, but we know that the lowest risk is if both parties are wearing a mask and you have that 6 feet of separation. Moving on to workplace screening. So this is going to be the screening for the school employees. So there is an executive order that deals with this, saying that, you know, you need a daily self-screening tool for all employees, and the Schoolcraft district will, you know, handle how their employees are going to do that. And we've also given them a toolkit and a screening tool for questions to ask and all of those types of resources. Moving on to student screening. So what we really want to emphasize to all of you is that this is largely a burden that's falling on the parents and the caregivers. So what we really want to stress to you all is that you all need to monitor your children for signs and symptoms of infectious illness every day prior to sending your kids to school. So, you know, we did send all the superintendents a screening tool for parents, and they will disseminate that out. And we really have to stress that if your child is sick, we can't take, you know, any risks here, and please do not send them to school. All right, moving on to more of the public health role here. So I'm sure all of you have heard of the term contact tracing thrown out there. So what is contact tracing? So this is a public health tool used to help stop the spread of certain communicable diseases. And, you know, the public health department is not new to this. We're well versed in contact tracing. So, you know, we do this with tuberculosis. We do this with all kinds of other, with foodborne illnesses. We contact trace to find the source. And so for schools particularly, we're going to identify others that may have had a close contact with a person who is confirmed with COVID-19. And the CDC defines close contact as being by someone for longer than 15 minutes and within 6 feet of that person. And the public health staff will begin the contact tracing by contacting these people who, you know, are considered close contacts who may have been exposed. A couple of other terms that have been thrown around there that we just kind of want to clear up. These are kind of used interchangeably, although the definitions are slightly different. So for quarantining, you know, this is used to keep someone who might have been exposed to COVID-19 away from others. So this is not a known exposure to a known COVID confirmed case. So this is just people who need to separate themselves, and this helps prevent the spread of the disease before a person knows if they are sick or infected with the virus without feeling symptoms. So people in quarantine should stay home. You need to separate yourself from others, monitor health, and then follow directions from the state or local health department. And if you are considered a close contact, then you will be speaking to us and we will help you through this. moving on to isolation. So isolation is different from quarantine in that isolation is used to separate people who are infected with COVID-19. So they are sick, they are infectious, and they need to stay away from others who are not infected so that they can stay safe. So people who are in isolation should stay home until it's safe for them to be around others. And the following are the guidelines for when it is safe to be with others and out of isolation. So you need to have 1 day without any fever and without using fever-reducing drugs. And your symptoms have to have improved. And it has to be 10 calendar days since your symptoms first appeared. So this seems like a lot to remember, but as I mentioned, if you are a close contact, the health department will be contacting you, and we're well versed in this, and we will walk you through this and let you know when it is safe and you are no longer infectious. So close contacts in the school setting, these can be all different types of people. So obviously your classmates, lunch mates, playmates on the playground or gym, and sports teams. And we just want to reiterate that this is on a case-by-case basis. So we have the craziest stories for contact tracing. There's so many different scenarios that can happen, not just in the school setting, but in general. And the public health department is here to help you determine if you are a close contact and what steps you need to take from there. So what happens when someone at school gets COVID-19? So if you as a parent are aware that your child has tested positive, you need to contact the Kalamazoo County Health Department immediately, and you also need to contact the school. And we will perform that contact tracing, as I mentioned, to identify anyone who may have had a risk of exposure. And we just also want to mention that the identity of positive cases are kept confidential. We respect the FERPA and the HIPAA laws that guide us for communicating about communicable diseases. So this is just a quick little flow chart here. So this is what the schools will be following as a protocol if there's an ill student or an ill staff member. So on the top and down to the right, you can see in the blue, this is if a student is ill. So if a student is ill with COVID-19 symptoms, and these symptoms that aren't symptoms of other diseases that are already known, the student will go to a designated location in the school. The student and the staff member with them will both wear surgical masks. The parent or guardian is notified. The student goes home as soon as possible. And then the school will call the health department. Then to the left there in the green, if a staff member is ill of COVID-19 symptoms, they will go home immediately and call the health department. So in that orange box there, we have some of the health and community services responsibilities. So this is what we at the health department will be doing. So we will review all the testing requirements. If you need to be tested, we will contact the school and the individual with those test results. We will perform that contact tracing if there is a positive case, and we will also review those return to school or work policies, as I mentioned before. All right, moving on to mitigation. So we know that COVID-19 has reached a community level treatment. Seem to have a little feedback.
Yeah, I was just about to say, if everybody could make sure that they're muted. James, I'm not sure if you can monitor that, but that would be great. Thank you.
Alrighty, so COVID-19 is at a community level transmission, and we have to do a lot of risk mitigation measures within the school system and honestly just everywhere else too. So we want to remind you all that all these actions, the health screening, wearing masks, social distancing, leads to risk mitigation, not elimination. So there's no perfect scenario where there's going to be zero risk at school or out in the community. But our goal is to keep this risk as low as possible and to keep the school and school activities as safe as possible. And having all these procedures and the roadmap and all these protocols is going to make this process manageable. So the following are effective mitigation strategies that the school will be employing. So staying home when appropriate. So the school will be educating their staff and families about when their children should stay home and when they can return to school, and they will be working closely with the local health department on that. We are following the CDC's criteria. And then the main point to drive home here is just that if your child is sick, you just can't send them to school. In the middle of a pandemic, seasonal influenza season is coming up. We just can't take that risk. So please do not send sick children to school. Moving on, another strategy is hand hygiene and respiratory etiquette. So, reinforcing that hand washing with soap and water for at least 20 seconds and encouraging to cover coughs and sneezes with a tissue. Next strategy is cloth-based covering. So these are meant to protect other people in case the wearer is unknowingly infected and does not have symptoms. Excuse me, went too far. Last slide here is that, the physical distancing. The goal is 6 feet to lower the risk of infection. We know that 6 feet or more is likely not possible in a lot of different settings, and we're not going for perfection here. We're just going for some type of distancing, as we know that it reduces the risk. Also keeping up adequate supplies of soap, hand sanitizer, all of the necessities. And lastly, signs and messages, posting signs that are highly visible and promoting everyday protective measures. All right, so these are links to all the different resources that I have covered in this PowerPoint, and a lot of them are super helpful for understanding what it looks like for the schools to reopen, the CDC's tools, and then you can visit the Kalamazoo County Health and Community Services. I update that the data for COVID and other data every single day. So with that, I will open it up to any questions, and Penny, our Personal Health Division Chief, and I will do our best to answer those, and if not, we will find you an answer.
So I believe our principals, thank you for taking the chat and reviewing. So I think that there are Matt, and Dave questions out there, and then we can open it up.
You bet. I saw a question regarding, is there a need to have all teachers, I suppose in any district, tested regardless of symptoms before school would start in the fall?
Okay, this is Petty. I can take that. Can you hear me?
Yes.
Okay. So we do not recommend testing individuals as a screening tool. I mean, the tests do pick up asymptomatic positives, but at this time what we're wanting is anybody who has symptoms to stay home, to see their provider, and to get tested. And the screening actually for testing is a moment in time. So if the teacher tests on Tuesday, they are negative, they could very well be positive. The fills come positive within a 12-hour period. So that's just a moment in time testing, and it's a tool used more for out.
Thank you.
Others, principals that we need to touch on, we can certainly open it up. If again, I'm needing to, anything out there in the chat?
There's a couple questions that I'll just maybe clump together, Mary. They have to do with people presenting at school with symptoms, and just what some recommended protocols are if that is the case. And when I say people, that there were a couple questions, some about staff and some about students, and what the response would be.
Sure. So, I showed that flow chart briefly. So, we know that this is going to be a complicated process. So we know that seasonal influenza is coming up. We know that the common cold is coming up, and we know that a lot of the symptoms for COVID-19 are similar to those. So, that's where, partnership with the health department comes in. And, if a staff member or a student is exhibiting symptoms that are related to COVID-19, we're going to ask that they follow that flow chart, and that, they go to that location in the school that's been predetermined, and they go home as soon as possible. And then we are recommending that they go to their primary care provider. And we really stress the evaluation of the pediatrician or the family health practitioner to evaluate whether or not they need to be tested for COVID-19. And that's kind of where that quarantine comes in too. So if you're symptomatic, we're asking that you don't come to school. If you develop symptoms, that you go home, you quarantine yourself, and you see your primary care provider to seek further guidance on testing. And then, if the test does come back positive, then we have steps to follow from there. And, as I said, it is going to be complicated with everything else. And there might have to be a large amount of collaboration with the school from the parents. If a student is asthmatic and, presents with a cough or something like that, that's a symptom of COVID-19. So, we're not wanting people to be over heightened about these symptoms, but we also want to be super mindful that COVID-19 is here, and, we want to help mitigate that risk.
Thanks, Mary. Another question asking if the health department has any research or data provided to them, or have you guys yourselves been able to forecast what COVID cases could look like if and when schools in an area reopen?
Sure. So this is a bit of a slippery slope. We've had a lot of different models that have been done over this entire pandemic, and I've looked at several of them. And the truth is, we can't predict this. This is a novel virus. We can't predict events in the community or other things like that can affect transmission. So no, we don't have a projection, but as the epidemiologist at the health department, I look at this data multiple times a day. I'm very familiar with it. We know how to identify outbreaks in the community. We're doing that contact tracing, and we will especially be looking at each school district very closely and monitoring for outbreaks, and if other responses are necessary to close the school or other interventions like that. So the simple answer is no, I don't have a prediction for that. I wish I did. It would make my life a lot easier, but we're just going to have to deal with this as it comes, and really use those risk mitigation strategies.
Mary, somewhat related. So a couple questions again, kind of in the same vein, so I'll just kind of clump them together. If a child is presenting while at school a COVID-like symptom, as the roadmap says, coughs, sneezing, fevers, the questions are, will they be sent home? Will they be required to have a negative COVID test before returning? I know the roadmap suggests those two things, but maybe from your expertise, you could just explain why the state return roadmap from Michigan would have it listed that way.
Sure. So yeah, absolutely. If they're presenting COVID-19 symptoms, we do want them to go home. As I said, getting evaluated by your primary care physician is really important, because they're going to help, determine if it's something other than COVID, if it's influenza, if it's, the common cold, if it's anything else. And it's hard to put a blanket answer on that because everyone's personal health has to be taken into consideration for that. So absolutely, if they're symptomatic, we want you to go home, we want you to quarantine, and then, you know, talk to your doctor about getting tested. A negative test will not be required to come back to school. So if you do test COVID positive, I went over the 3 things that you have to do. So you have to have 24 hours without a fever, without fever reducing medication, and your symptoms have to have resolved, and it has to be 10 days out from when your symptoms first appeared, and then you're cleared to go back to school. It is a little muddier if you are symptomatic and you aren't tested COVID-19 positive. Then we're just going to ask that you know, your child stays at home until they aren't sick anymore.
Are there a few more questions here?
Yeah, one just came from Lindsay. Is it still understood that children may be carriers and remain asymptomatic and thus never tested for COVID? My concerns are for the teachers and the families and children that the children go home to. I'm wondering if the statistics are lower on children because they tend to be asymptomatic and never get tested. Does that make sense?
Yes, so we are seeing that children can be asymptomatic carriers, and you know, that is unfortunate in, you know, tracking the disease transmission, but that's why we employ those risk mitigation strategies such as wearing a mask, the physical distancing, you know, the hand hygiene. There's a lot of things that are being put in place, and as I mentioned earlier, there's never going to be a 0% risk here with this disease, or quite honestly, any other disease, you know, seasonal influenza, the common cold. What we're trying to do is bring that risk down as close to 0 as possible, but, you know, we're never going to eliminate it. And unfortunately, it will be hard to tell if, you know, children are asymptomatic carriers. And, you know, the comment to folks at home who are at higher risk, then we need to take that into consideration, you know, in your own household, if there are people who have comorbidities or, you know, health conditions. Penny, it looks like you wanted to jump on there.
Yeah, I just wanted to say that we've had our daycares open too. Many of them have been open right from the start. At least 18 daycares have been open, taking care of our essential workers' children. And we have only had, with all of our daycares, now there's like 50 some that are open. We have only had 1 child infected and 1 adult infected, and that was we did the whole contract tracing and everything, and we never got a secondary case in either situation. So they are seeing that these children are less likely to transmit the disease. But yes, I do agree with Mary, they can be asymptomatic carriers as well, but they are less likely to transmit it. It's easier for them to transmit influenza.
If I could chime in here just to honor people's time as well. There are, you know, first of all, we felt like it was extremely important to have the health department really share where, you know, and how COVID, it has impacted our community, and that being Kalamazoo County. I do know, in asking Mary for some data, we are 1% Schoolcraft. Is 1% of the total cases in Kalamazoo County. So doing a nice job there. But I think we really do need to move forward. I think that the reason why we shared the importance of where we are is you all have to make some decisions for your family and for your children. And this is extremely important. And to have the experts come into play, to learn a little bit more about it, we felt was extremely important. So thank you, Penny. Thank you, Mary. You guys are amazing. I appreciate our time on a weekly basis and appreciate the extra time that you're spending here with us. If you have any questions, further questions, and I have them every day, they're very accessible. So we can be that middle person for you and get questions answered. But if you guys could just thank us, thank our visitors for being a part of us. We're going to let them move forward. And but thank you again, Penny and Mary.
You're welcome. And if you want to compile those questions and send them to us, we are more than happy to answer. That's what we're here for.
Yep, and we wish you the best of luck in the coming school year.
Yeah.
Thank you so much, both of you. We'll be, I feel like we're cousins because we see each other so much now. But again, thank you so much.
You're welcome.
All right. So again, that was the first portion of the presentation. And now that we're going to get into the parent survey results, parents, thank you so much. In a short amount of time, we had 98% of you take the survey. And so we use that data to help us frame a proposed plan. Again, I'm going to put proposed out there because what you'll see is based on the numbers of each option. So for example, this was the first question. What are you most comfortable with? Face-to-face? Most, just above 50%, so 54% said yes. We want our children back face-to-face. Hybrid, 30%. Virtual, and that again, there was a distinction between some virtuals, SCS that would be taught by our people using our curriculum, and then a pilot program that we all county schools have taken on as a collaborative, and that is called KVIC. And they use a curriculum that is purchased, Michigan Virtual, which we use a lot of, and then at the elementary, Lincoln Learning. So we're going to be sending some more literature out related to KVIC as well. And then a few have said, look, we need a timeout. We're not going to enroll our children. And so again, we respect everybody for their opinions and their viewpoints and ultimately their decisions. But this is what the final results were related to the preliminary survey. Again, we're not locking you in, but if these numbers change, significantly, then we really are kind of back to a brainstorming session because, as you can imagine, we are not able to go face-to-face 5 days with all of our kids because we are not going to put our kids in that position, nor are we going to put our staff. This is we are following the protocols of 6 foot distancing, masking, and what have you. We'll go again allude to that a little later. So as you can imagine, the first choice when you look at and I'll be quiet, but when you look at the options, so we said, hey, would you please rank order? We had almost 600 there face to face, and as you can imagine, not the least favorite is the Kalamazoo Collaborative. So again, just giving you a visual of this, we are sharing this out. I didn't want to spend a ton of time, but just giving you another visual of how you ranked ordered the 4 options that we had posed. The next question. So 202 parents, when we talked about face-to-face, would you need daycare? So this is for our elementary folks. Again, wanting to just gauge if we didn't have 5-day programming, or if you went online, fully online or hybrid, how would this impact you as a family? And so more than half said that we will be able to supervise our children. And then we had yes, so that 202, that 20% is again just a little over 200. So as you can imagine, our Eagle Zone would not be able to equip this. I know that there's other wonderful programs in our community and extended community, but that's still a lot of children that would need to be tended to. Then we talked about buses, and folks, if you got the answer here, we certainly don't. Again, if we said, hey, do you need busing? We run, and Mark Fox, I know he's on the call here. I believe we ran on the average 360. So 302 said, yeah, we need the busing. And that it would be challenging because here we are talking about social distancing, but and this is how we struggle with this as educators. And I think somebody chimed in too, you know, we can't meet with 10 people, but we can have school. Look, I'm not going to debate things, but that's just the way it is. The busing right now, you're allowed to fill the buses. I'm not real comfortable with that, but let's see. And when we put out the registration, that number, again, as the superintendent of Schoolcraft Community Schools, I'm not real comfortable with. And I know Mark Fox, our director, isn't either. When possible, we're asking families to transport their children. And yes, I know our elementary and middle folks, the long lines will be extended, but as you can imagine, these are not ideal times. But safety and well-being of our drivers and our kids are important. So just again, sharing out there. Then we talk about wearing masks. So also part of and Mary had alluded to this earlier about the wearing of masks. If the blueprint said that children do not have to wear masks if they're self-contained at the elementary level, in working with our staff, and while that number is low of fatalities and the percentage of kids that have gotten COVID, it heightens as you grow, as you're older. And so who's working with our children are, 20s, 30s, 40s, 50s, 60s. And we might have some 70s, but we have those ages that are caring for our kiddos. And so again, their safety and well-being is of the utmost importance to us as well. And so we are, and we'll talk about this a little later, we are asking people to mask, our kids to mask, and we'll share that out a little later. Even looking at the data with the safety, we have some pregnant staff members. We have a number of challenges. So I'm just going to share that, and then we'll report out when they are to wear their masks at the elementary level. Okay, so I know there was some folks that really wanted to get there right away. I apologize, but again, we wanted to set the table for this. So we really looked at and spent a lot of time, folks, hours and hours and hours of time just trying to make sense of what, the data from all, listening to our people and all stakeholders. And we really strive to offer options here with the proposed plan. So you again see the face-to-face. You'll see the hybrid, and that hybrid, we asked about the Schoolcraft model as well as the KVIC on the virtual. The hybrid would be an alternating day, and again we'll go there as well. But those are the four things that we really looked at when putting our options together. I'm going to turn it over right now, to our middle school principal, Dave Powers, and he's going to kind of just share out where we landed as far as the option of middle school and high school, because they're collective, and then the elementary, and then we'll stop and be quiet and get some questions thereafter. Dave?
Great, got this. Thanks, Dr. Stitt. And again, I want to thank the community impressive response to the preliminary survey. That data really helped us frame what we would be able to accomplish within our facilities with regard to all the required protocols, the spacing and such. So thank you. You can see that we've made a couple of tweaks to the preliminary survey options that we threw out there just to kind of set the stage. So the face-to-face would not be at the secondary level, would not be a 5-day a week. It would be a 4-day a week face-to-face all day for those 4 days. The hybrid would be alternating days face-to-face. So like a Tuesday, Thursday, Wednesday, Friday option. And there were some questions in the chat as to how that would be assigned. We would make sure that families, not just last names, but that families that choose the alternating day hybrid option would be served on the same days. And then, of course, if you are looking for a fully distance learning, virtual learning option, we decided to put all of our efforts into the KVIC, going to those platforms that Dr. Stitt talked about, which is the Michigan Virtual, used to be called Michigan Virtual University, and the Lincoln Learning. We've had tremendous success at both the high school and middle school with students in those platforms. We felt that staff exerting energies to become fully virtual at the same time they've got energies to serve students in a face-to-face capacity, whether that's 4 days a week or an alternating day hybrid model, would actually be overwhelming and diminish their effectiveness with the students that they serve. So if you're looking for a full virtual distance learning at home model, it would be the KVIC, and I can't speak highly enough for the two platforms that are represented in that model. And the day that students would not be in the building would be dedicated for our staff to be preparing. It'd be like a virtual learning day for the secondary students, for them to be preparing their lessons and reaching out to those students who are every other day, making sure that we've got strong connections and monitoring those students, even though they're on an every other day basis. So that's it for the middle school options. I'll turn this over to Mr. Daly now to talk a little bit about the high school variations, if there are.
Yeah, thanks, David. You did such a good job setting up the secondary perspective that there's not a lot of difference between what you highlighted with middle school and what we'll be doing and providing at the high school as proposed right now. A couple questions from the chat is, what day of the week would the middle school and high school students have off and be learning virtually, whether they're face-to-face or hybrid? At the moment, we haven't landed on an exact day yet because we want to kind of do that in conjunction from a K-12 perspective in the event there's kids in the elementary school that might be hybrid in some days, and we don't want to have high school students required to be in class in the event that they need to be home to provide a little bit of support for their younger siblings. So we are trying to be mindful from a K-12 perspective of what the selected day is. Our teachers and just kind of the reality of where the numbers are with COVID, we think we're more likely in our best, non-medical brains to think that it's likely that at some point this year we're going to be back to phase 3, where all of in-person instruction, would be suspended for a time being. And so we're really trying to be mindful of having all of our teachers and all of our students equipped with the skills and dispositions to be able to make that pivot relatively quickly to go from any form of in-person instruction to being all really prepared and equipped to be able to do that from a distance and have to do it remotely and online. That's kind of an intentional choice for us. We had a lot of learning lessons that came out of the spring. And, while we've been reflecting on, what asynchronous, synchronous learning platforms are, what learning management systems are the most effective, how do we mainstream communication, how do we reach all students that have questions, we want to be able to, learn forward from our spring experience and to be able to do that well. So we feel at the moment that by building in a virtual day for everybody at the secondary level, it would allow us to pivot more effectively from in-person instruction to then going forward and being able to provide instruction online.
Thanks, Matt and Dave. Why don't we turn over to Matt Webster, because there's a different variation there at the elementary, knowing that there our young learners, first of all, aren't able to take care of themselves at home, and they need the foundational skills. And so, Matt, would you please take the lead and share about the elementary options, please?
Yeah, thank you. So, thinking back a while ago to that parent data, you saw that roughly 55% of families wanted face-to-face, 30% were opting for a hybrid option, and another 13-14% wanted to see a virtual option. The reason the elementary school is tentatively going to attempt to pull all of this off is because of the way that it's structured. As you know, elementary kids stay with their teacher all day, and that just makes a few things a little more manageable than at the secondary level. So there's some questions during the secondary presentation about, why 5 days a week compared to 4. So I'll get into all of those details. Before I do, I want to say that, we are Schoolcraft community schools, and this elementary plan works as long as the community, us with you, work together. And you'll see why as I kind of go through the numbers. So what we're going to try to do is take roughly 3/4 of our teaching staff and dedicate them to the 55% that want face-to-face. And that works because the class size comes down immensely in that model, and we're able to space kids out in a way that's safe for them and safe for our teachers. The way that works then is when the other 40 to 45% of us opt for a hybrid or virtual model because that's your choice or because you have the means to do so, you're actually doing us a favor when it comes to executing this plan, because we need those students in those two models for this to work. So for the hybrid and virtual students, they would have the same teacher actually. So let's just go through the scenario and imagine that they're in 3rd grade. The hybrid and virtual students would have the same 3rd grade teacher, and they would be 4 days, that teacher would have students in her or his classroom for 4 days a week. When right now we're talking maybe Monday being the off day. So on Tuesday, Thursday, as you read in the book we put out, on Tuesday, Thursday would be group A, Wednesday, Friday would be group B, and everyone's week would get launched on Monday with a full virtual day for all of those students. It's important to stress that for our hybrid students, those students are still engaging in school with us 5 days a week. They're just only physically sitting with a teacher for 2 of those. So they'll get all the support, all the instruction face-to-face for 2 of those days, but it'd be expected to kind of work along with us for all 5. And for those that choose Schoolcraft Virtual, the same can be said. There would still be expectations 5 days a week. This option, the Schoolcraft Virtual option, would still have perhaps some appointments, Zoom appointments to be on throughout the day, and your teacher at the other end of that learning platform with you. The online KVIC option, the Kalamazoo Valley Collaborative option, is through Lincoln Learning. I had a chance to sit on a number of trainings and kind of get an eye on that program, what it looks like from the teacher's perspective and from the student perspective. And I'll say this about it, for the families that really require some flexibility during this time and want to be safe at home during this time, this is not a bad option. It's pretty well built. It follows the same standards. And it is all asynchronous, which means you are not going to find a live teacher at the end of any of this program. It's all built in for you. For some, that might be appealing. For others, it's not what you want. But we're not here to sell any of these programs for anything that they're not. So I want you to be fully aware of what those are. So that's kind of the gist of it. Again, I'll just kind of recap them all. Face-to-face at the L is going to be 5 days a week, and we're striving for lower class sizes. Hybrid is going to be 2 days with us, 3 days away from us, but still learning all 5 days. Schoolcraft virtual is with our teachers, and again, expectations and maybe some appointments, Zoom appointments, all of those 5 days. And your KVIC, which is Lincoln Learning, if you want to Google that and explore that yourself. Lincoln Learning is the program that really kind of gives you the ability to learn at any time of the day, but you don't have one of our teachers or even hardly the county teacher at the other end of that program. There is going to be a teacher there as you need them, but they're not going to be live teaching you. It's through built-in programs in that platform.
Let's get some questions from the chat again. Sharing my screen, I can't see them. So principals, anything out there to ask?
If I could weigh in just for a minute, there's questions as to the SCS virtual, and I appreciate the sentiment that for many families, what we were doing in the spring seemed to hit the mark and worked well for some students. And I just want people to know and reiterate, as I mentioned earlier, that asking our staff to prepare for face-to-face instruction, as well as paying attention to their hybrid sections, so different kids coming in every other day, and making sure they're attending to and following up with groups of students that would be fully virtual and never face-to-face, was really putting our staff in a difficult position and overwhelming, so that they could not be as effective as possible with the students that would be in front of them each and every day. So I apologize that that's disappointing to some, but just understand that besides the physical concerns that we have for health and safety, we want to make sure that we're keeping people mentally and emotionally well and safe. And that includes our staff being able to serve our kids. So again, I apologize that is a disappointment, but again, I cannot speak highly enough for the platforms that we've made available that are self-paced. Your student can go as fast or as slow as necessary to get through that curriculum on the Michigan Virtual or the Lincoln Learning. And we've had students be very successful in that model.
Dave, I couldn't have said that any better. So thank you for stating that very eloquently. Yeah, we agree that that would be a heavy lift for our staff. And so that ended up not being a viable option at the secondary level. So again, apologies, but that is important for to keep our people sane, and they have a livelihood as well, and we want to keep them upbeat and doing their best. So that's where we landed with the two options. So thank you. Other questions regarding options, principals?
I'm sorry to chime in one more time here. Questions about hybrid versus or any of the other pieces. Would hybrid students be mixed in with face-to-face students? Those are separate sections of students. So we are basically a 3-section district. In the middle school, it would be 2 sections that staff were teaching of the students and families that chose face-to-face, and 1 section every other day of students that had chosen the hybrid. I know that's a little bit different at the elementary school. I believe the secondary high school is similar, in which these students would be cohorted. In other words, a cohort means they stick together, and same students each day, every time for that period, would be seeing that teacher, which is another one of the health protocols to be followed to keep people safe. So the long answer to a short question, no, hybrid students are not mixed in with our face-to-face students in their classrooms.
And that is K-12.
Dr. Stitt, there was a question, what if at this 9-week interval, when we have a chance to maybe select a different option, depending on what we selected the first time and what we selected the second time, would my child's teacher change? So I want to talk about that because I want to just be really clear again, not trying to sell something for what it is, for what it isn't. Being a school our size and trying to pull everything off, this is a very detailed plan, and it's all based on meeting the needs of the community. So if the community needs change, the roles of the teachers within that school are also likely to change. So there is a chance, depending on how drastic the demand shifts, that the teachers' roles and the student assignments to those teachers could shift as well. Obviously, we know the importance of connecting students to a teacher and what that relationship means over a typical 9 months. But this is a very atypical school year that we're looking at. And we're going to do our very best to make sure that we don't jostle, classes and students around. However, we also know that, putting 32 kids in a classroom, while trying to keep some of the pre-established relationships there, we know that that's not safe either. So we'll do our best, but our best in this situation may not be what our usual best is like.
Yeah, again, well said, Matt. Any other question coming out before we move forward?
I just saw a couple questions about hybrid kids, and I think the question is coming from a line of safety. So I'll reiterate it at the elementary school. If a student is hybrid, they are in a classroom that is unique to them with a teacher that's unique to them, and they're there all day. They're not mixing in with kids that are face to face. So I hope that gets at what that question was driving at.
So maybe just another, if they're for let's just say, I saw Kristen Caroselli in the meeting here. Let's just say 30 kids take on the hybrid, and she's the teacher of fourth grade, taking on the online and the hybrid model. So Monday, Wednesday, she would have 15 kids, and then Tuesday, Thursday, knowing that there's a day that's not there, I'm just choosing those as the 2 days. She would have the other 15, and that all day.
Dr. Sid, if you don't mind me jumping on, we've got a couple of questions about early middle college and then our education for employment classes. Early middle college and KVCC, who facilitates that, is sticking to doing all distance learning for classes that are not in labs. So if it was a science class that needed to have an on-campus lab, they are honoring that as like one of their only on-campus commitments, and that's extremely limited and controlled numbers of students at a time. Otherwise, all KVCC classes that would fit into the early middle college or dual enrollment programs, are going to be done from a computer. One day, as I think was communicated lately to Mr. Ludlow, one day is going to be a synchronous component where the professor will jump online and everybody has to show up at the same time. The other day for the week will be asynchronous, where there'll be homework posted or reading or discussion boards to facilitate learning at that time. Now, education for employment, the EFE programs, at the moment are a little bit up in the air. It's not that they're not going to go through, but I just don't know where they're going to go through at. 12 of the 18 EFE programs, are in KPS buildings. And at the moment with KPS's plan for returning to school, there's no in-person instruction going on at the moment there. So they're trying to figure out if KPS will have the buildings open to honor the EFE programs, or if EFE needs to look at other high schools in the county to help facilitate that for in-person live instruction.
Again, I think to honor time here, I know that there's a ton of questions. Again, I can't see those because my screen is being shared, but please keep the questions going. We are putting an FAQ out there. It launched prematurely. We will get that back on track here. Tomorrow our goal is, so I will say that hopefully we'll be able to launch that again tomorrow. But all your questions will help us get some more, and that will be a laundry list of questions, knowing that you need to make the best decision possible. Do not hesitate to contact us. And so our information will be on the last slide as well. But let's move forward regarding the protocols and all that, if we can, please. So as I'm going to move this, maybe not. As our partners said, our job is to also strive to mitigate the COVID, and these are the big three. Social distancing. So as I said earlier, 6 feet, that's important to us. And so we're really striving to, in the classrooms, have settings that honor that, and have worked with our staff regarding that. Masks, and you saw the point with Mary, mask, 6 feet, best situation. And then we'll talk about some proper hygiene because we need to keep our students, germ-free as much as possible, and then also, our surrounding, our buildings and equipment. So screening, unlike, we feel like we can take on that. We also believe that as parents, if you could do so prior to, that would be great. But we will be taking temperatures at the elementary. They will be done by their teachers, their respective teachers, as they come into the classroom. Again, we're just trying to ensure that the safety of all. At the secondary level, we are going to take temperatures as they enter the buildings. So we are going to man that. As our experts, Penny and Mary, said through the health department, please, 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 please do not send your children to school with one of the symptoms, one or more of the symptoms. And then as it's resolved and the CDC guidelines, until they've not had those symptoms, we can't have them. And we will do our part to aid in educating your children from afar, from even if they chose not to do the online or hybrid. If it's a face-to-face, we're gonna do our part to help continue to educate your children. Wearing masks, the next big piece. As noted, all adults are required to wear masks. So 5th through 12th graders will be taking masks. And here's that, as I said earlier, students in the face-to-face model will wear masks when on the bus, and that's a mandatory piece from the state, in the halls and bathrooms, which is mandatory as well, when working closely with the teacher. And so again, as we talked about with that age and what have you, we do not want, we want to keep that 6 feet distance. And so when will be those times, we're asking kids to mask up because again, our staff will be there as well, learning and interacting with students from other classrooms and or in the classroom, but out of their assigned seats. So if they have to sharpen their pencil or do something, again, we're asking them to mask up. District, we will provide masks for those who don't want to bring one, but you can bring your own. If they are disposable, again, they're only used one day at a time. A lot of people have their own, masks, and I kind of like, it's like art now, seeing what, oh, you're, wearing, a cute one, whatever. So please, those need to be laundered as well, and so we will allow those. So this is a biggie. Face shields are not a replacement. That is something that we can't take on. So a face mask doesn't take, or face shield doesn't replace the mask. And then, there are circumstances, those who have medical challenges, if they get the doctor's note, they, again, we know some may not be able to wear a mask, and we're going to honor that as well, but we will need that doctor's note. So just stating masks are extremely important and we're taking them very serious. I will also add that that's a long day. And so Matt Webster has built in 3 recesses for every child at the elementary. And we've also said to staff, if you need a break, take a break. And so again, these are not ideal times. You've heard that already multiple times. At the secondary level, same thing. We need to give our kids breaks. We need to give our staff breaks. All staff members will be mic'd up because again, if you put your mask on, it's hard to hear sometimes, right? So we're gonna mic them up and require that be used to help get the audio a little better in all classrooms. Moving on, we go to social distancing. Again, the 6 feet, it's extremely important for us. We've taken pictures, we put people in places. We're using some dividers. We bought a fair amount of plexi that will be used in the classrooms and in our folks that work with our students. You know, we have these reading tables, you know, the circles. And again, we want to continue to educate, but we need that buffer. And so we'll be doing some things a little differently. Our offices will also be with plexi. You know, everywhere you go shopping, they have the plexiglass. And so we will continue to do that, just sharing that social distancing, the 6 feet, we're going to strive and educate and communicate that out with all parties. Hygiene, so that was another biggie that was touched on. This is extremely important. So we will have hand sanitizer in every classroom and in hallways. We also have, we'll teach kids. So we're gonna do some videos and teach everyone how to wash their hands. I even got that lesson by Dr. Buhite when this all started, and we were bringing in volunteers to help with our making food for our kiddos. And so it was intense, and he was a great teacher, but you know, there's a lot to it. You might not think so, but we want to make sure it's safe, and so we'll be putting and educating our kiddos on the appropriate ways to do so. And then we're also, you know, a number of times, especially at that secondary level, you know, hey, I'm going to share my locker with my boyfriend or girlfriend. We need to keep our separate items. The cubbies and the containers that are in the center, we're not able to share. The sharing of pencils or rulers or what have you, that's not to be this year again. So when we're with Coach Kolchak and we're doing kickball or what have you, or if it's recess and we're playing basketball, we will be spraying down all equipment, and that goes for our playground equipment as well. We're going to be asking for assistance, especially at our secondary level with cleaning, because they switch classes every hour. Again, it's all of our responsibilities, but if some choose not to, we're going to respect it. But we're going to have wipes, gloves, spray bottles, and paper towel, you know, in classrooms. And we're going to ask that this be a responsibility on all of us. We will also be bringing an additional daytime custodian in play, and they'll hit the key areas and in classrooms during planning periods and recesses. So we will have a very regimented cleaning protocol for our folks to follow. Athletics, we're just going to follow MHSA right now. It's on. And if you come to the high school, you'll see some kids work out. Our coaches are working hard with them. And they're following protocols. but we just wanted to put that out there because I know this is a town that loves its athletics, and I love that too. So you know, band, all of our arts are still on as well, and we'll be putting some safety measures in there as well. Looking at building schedules, so we just are not able to, and you know, some of you don't like this anyways because it can be a challenge, but it really has been a big piece for us to grow as a district because our staff really need time to collaborate, but we are these under not ideal situations. We are cutting our delayed starts. So the Thursdays, the many Thursdays, that extra hour is no longer. So we will need to cut that. We don't have the personnel to take on the children that come early, and so, and really again to honor as much instructional time as we can. That's important. Designated entry times to limit students again in the building, and so we will get that out there. That, you know, it's just, you can't drop your child off at 7 a.m. and expect we will not be opening up our doors. Again, we really trying to work with the social distancing, and so that is also something that's important. The middle and high school, we're looking to take on a semester schedule. So instead of the trimesters with the and it was kind of the trimester, especially at the high school, was not an equal 12-week. There was a mini at the end, and we're going to put all our time on the core courses and get good at that and give the quality time to our kids. Those minis were great. It allowed more college opportunities, but again, this year that we felt is not something that we were able to take on. So some of you are saying, you know, so where do we go from here? As you know, today was a beefy day for us. We worked with the staff for a couple hours, and again, I can't say enough about our folks. I love and care for them, and they've certainly helped us, you know, really learn more from their perspective. And so we appreciate them. The board adoption. So the board adoption, as I said earlier, is really about the protocols. There's no question because we're following the governor's plan. They're not approving this instructional option, the instructional options. It's just the protocols, and that is Monday. Feel free to chime in. That is with Zoom as well. Student registration. So, and we may bump this up again, just to try to get numbers through earlier, but we need to know where you're going to land as it relates to your child's education. And so the sooner the better, because then we can help, that will help us modify if needed. What you see is what we're proposing, but as we've said a couple times now, if the numbers are changed significantly, we are not able to offer that proposed plan, and so we will have to go back to the drawing board and look at some alternatives. So, you know, again, August 17th through 21st, it's the week before school. I mean, that makes it very difficult. So we pointed that out August 11th. Well, that may be altered here a little bit, but just know that when we launch it, we're going to ask that you, you know, again, take some time, get educated, contact us, but we need the selection to help us solidify our numbers. And then final plans will be rolled out there on the 24th is what the tentative schedule is. As we talked about, look, you see some cell numbers there, and as many of you have taken on our jobs, we take very serious, and I, first of all, do not mind you texting or calling me. If I'm not available, I won't be able to answer, but I will get back to you. So there's our emails. of some key leaders that, again, we're very blessed to have. And so with that, we're going to go back to the Q&A. We've kind of, in a nutshell, kind of gotten our presentation there, and go with some questions. So go ahead, guys.
Rusty, can I address something first that kind of popped up throughout the thread as it was going for a while there? So we, in presenting the elementary, middle, and high school plans, we glossed over the early childhood programming. So I just wanted to take a minute to speak there if I could. So for those not entirely familiar with our preschool program, there are some tuition-based spots. There are some GSRP, Great Start Readiness spots, and that makes up our whole program. We have not been given a whole lot of guidance yet from GSRP as to what their expectations are going to be for that program. Therefore, I can't really give you a lot of information as to what a preschool day may look like. The only thing I can say is that if we are given the chance to run preschool face-to-face, I know there were some questions about arrival and how would that go with the littlest kids if adults aren't allowed in the building. We would schedule that preschool start and end of day at significantly different times than the rest of the school, so that we could bring your preschoolers in and out of that building safely, knowing that you, the parent, can't come in and out of there. Young fives was brought up, and I just want to speak to that. Kindergarten is kind of a big unknown because that's the cohort of kids we haven't really met yet. And the same can be said for young fives. So what I do know is that we can't have our one young fives teacher teach everything. It's not possible for her to teach face-to-face, hybrid, and virtual, and meet the needs like we can in a different grade. Depending on what we are able to do and what our numbers are going to look like, we have talked about scenarios that include young fives in a face-to-face option, and we have talked about scenarios that running young fives is just too challenging of a program to offer this year, and instead moving that staff member to kindergarten and offering a robust kindergarten experience instead. So that's not an ideal situation either. We love that program and we know that it has significant value in this community. However, the state of Michigan still hasn't given us a per student budget allowance yet, so we don't know what our final budget will be. We've already added staff tentatively here in 2 buildings to make as much of this plan work as you see. So kindergarten and young fives is kind of hanging out there as the unknown. And I know that team is feeling the stress as much as I am. Nobody likes the unknowns right now, but your data next week is certainly going to be incredibly helpful for us as we try to make that decision, and we do not want to leave you hanging any longer than we have to. So we are going to communicate clearly and quickly with you as we make those final decisions. So that's really as much as I can share about young fives and preschool at this time, because those 2 programs are the programs that we know the least about, unfortunately.
Yeah, thanks for bringing that up. Yeah, that wasn't part of our presentation. Now that I'm not sharing my screen, I'm able to take on a few of the chat. One of the questions related to a soft start, and that's been discussed, and really it was recommended by our staff, and so we appreciate that and respect that, knowing that all of us are anxious. Okay, Rusty still included, right? We haven't been in school since April, and again, the safety and well-being of our staff and students, I mean, that's a heavy lift on my shoulders and all of our shoulders. But to try to put a plan in place, I mean, we all have emotions, and so it was discussed to maybe do a soft, start, and what's that look like? It could look like half days. What we've discussed thus far is, the first 2 weeks. So we have 3 days the first week, and then 4 days that Labor Day. So Monday is that and then 4 days thereafter. So the Tuesday, Friday. So we're talking 7 days of, is it an alternating day? Are we half days? Again, we've not landed, but I do appreciate it. I think there's some sense to that, and really easing everyone in, because again, as adults, I know what I'm feeling. I can't imagine, what kids are feeling too, and we have to teach them a lot about the protocols as well. And so just know, and it may not just be half days. We may do it after lunch to get them through a lunch to teach them. And so just bear with us. We'll continue to work with the staff. If you do have any thoughts, please certainly share them. But that's kind of what we're thinking of, and we'll continue to work with our staff on that one. Other questions? Again, I just started glancing. Principals, anything?
You stated it at the beginning, Dr. Stitt, but there were questions up here. Some of it I think is probably just some human nature. It's like, here's your menu, eat it and like it. That this is all set in stone and won't be adjusted or changed at all. And I responded just a second ago, we asked for some feedback on some options in the preliminary survey. And then based on those responses and the feedback that we got from staff, and also the changing landscape that comes from Kalamazoo County and the state and such, what is presented tonight was in response to that kind of feedback and that kind of data analysis. So once the registration takes place and we have some hard numbers and decisions that families have made, then we will once again make decisions as to are all these things doable. To your point, I think, if a 100% requested face-to-face, that would not allow for social distancing in our classrooms. So I just want to reiterate to our community that we want your feedback, and this isn't just a, ram this down people's throat and the decisions have all been made. We need to start with something, and then we get your feedback on that, and then we'll respond to that like we did in the last couple of weeks.
Yeah, and again, I don't know how many times I said proposed, and I hope that all the literature that you have seen, it says either draft or proposed. So again, we can't land on anything because we don't have those registration numbers. We built it. Somebody had asked, hey, have you thought about just a online piece? And, some other districts are doing that. Just hearing from our families, 54% said they want face-to-face. Another 20 some odd percent said hybrid. So that, you put those in combination, that to us felt significant that people wanted some face-to-face interaction. And we strived, again, we can't make everybody happy. I wish we could, but we really worked hard to try to put a proposed plan out there to meet most of the people's needs. So sorry about that. I did see a question about how specials work. Again, just to reiterate, we specials at the elementary, they're going to be in the classroom, I believe is what we're discussing. PE is going to go out. As much fresh air as possible. We're going to run the doors, or the windows, excuse me. So as much fresh air as possible. We do have ventilation systems in every classroom. We'll be running that throughout the day as well, not taking breaks there. We've talked about some running of fans still. I want some guidance on the health department on that one. But we're going to do what we can to continue to provide the best services. I did see a question about what's a schedule look like. We're going to try to keep the schedule as tight as we have in prior years. We're going to take some breaks, so just letting you know, because our kids need breaks and our staff need breaks as well. But what you see as a prior schedule, we're going to try to honor that as much as possible in this proposed plan. Other questions, principals? Anything else out there?
There was a question regarding the KVIC choice, and I think it's really important to stress that students that choose the KVIC full online option are still Schoolcraft Community School students. They're fully ours, with all the rights and privileges of the electives or the after school, what's the word I'm looking for?
Extracurriculars.
Extracurriculars, thank you. That's an important thing to remember. And yes, there will be Schoolcraft staff that still checks in and monitors, guides, facilitates, I don't know whatever word you'd like to use, but we'll still be connected to our KVIC students, checking in with them.
Matt, did you have something? You came big screen on me here. No?
You may have picked up my keyboard typing. I apologize.
Okay. Matt, why don't you, I mean, we do have, again, we're going to be here, but trying to honor people's time. We've got about a good 15 minutes that was designated. Matt, you want to kind of teach them about the raising of hands, and let's hear from our families, our parents.
Yeah, so there's 183 of you, so we will do our best. However, at the bottom of your screen is a participants button. And if you click that, there is another button that you can click on that says raise my hand. And what that does is lets those that are moderating this conversation to see that you have something to say. We'll call on one of you at that time so that there aren't 6 or 7 of us trying to talk over one another. So if there is something that you'd like to ask that hasn't been addressed in the chat, that is a way that we can try, or that you rather can try to get our attention, and that we can then give you a turn to do that. So again, it's the participant button at the bottom of your page.
Go around, Marty.
And then a raise my hand button after that.
All right, folks, chime in here, please.
Lindsay Gignac has a question. Lindsay, if you'd like to unmute yourself and ask the room, we'll do our best to answer.
Yeah, when Mr. Webster was talking, I was trying to absorb everything, but I'm just wondering that, so my son was born on October 1st. He was supposed to be in Young Fives. If that is decided that we're not going forward with that, he can join kindergarten. When you said a robust kindergarten, I guess I didn't really know what you were.
So it's those students that are completing a waiver that typically end up in Young Fives. And it's that program that we're not sure at this point if we're going to be able to offer it or not. So obviously, if we take all those Young Five kids and move them into kindergarten, we haven't solved any social distancing problems. So
right.
If what we're committed to, and we've told our teachers this, is we are committed to keeping them safe and distancing everybody in our classrooms. So there's a lot of information that's going to come in next week that is incredibly important to us as a whole district. My eye is going to be on that kindergarten data, because that's my biggest concern, is keeping that group safe, because again, that's the group we don't know as much about. So it's really going to depend on what that information looks like and what we're able to do with it next. I just can't promise that Young Fives is going to be sitting out there as an option when this is all said and done. But at the same time, I know we can't take 18 waivers and just put them into kindergarten and have safe kindergarten settings either. So a difficult decision to be made, and it won't be made by me alone, but we'll be making it as quickly as we can once that information is there, and disseminating that decision out to everybody that it would impact.
Okay, thank you.
Yes. So Lindsay wins the prize for finding the raise my hand button. She was the only blue hand to come up, Dr. Stitt. You'll have to mail her something. And now that we've given away a prize, Jen has raised her hand. Jen, if you can unmute yourself and ask the next question, we'll try to help you out.
Yeah, no prize needed. I just wondered what the general consensus was for the teachers. I've been seeing protests from Vicksburg and a couple other areas on going back to school, face-to-face learning. So I just wanted to know what their disposition was overall.
We do have, I don't want to put our teachers on the spot. There are a number of teachers on the Zoom meeting, but look, these are tough decisions, and I'd be lying to say everybody's really totally on board here. You know, we have some that would like other options, and so you know, this is very challenging to really strive to make everybody happy. So I don't, again, Kristen, I don't want to put you on the spot, and you don't have to go there, but I mean, you certainly can. You know, you're the voice of the staff. But I think I just wanted to share. I mean, they've been very supportive. They've always been supportive. We've got a great relationship with our people. If you saw, and I didn't really, they're the ones that told me. There was a signed union stance from the whole county, and it kind of moves me. But one district did not sign that dang gone thing, and that's Schoolcraft. And that says a lot about us and our people, because you know, we care and love one another, and as I share, I mean, these are tough times, and you know, the safety of everyone it has to be there for all sakes. So you know, I get a little choked up, but we've got great people, and they're going to do whatever is asked of them. I totally believe that at the end of the day. So Kristen, again, you can just be quiet, or where are you? Okay, maybe she's quiet, or maybe she left. And you know, again, I really didn't want to, but just being honest, not everybody's on board. We're going to continue to work with our staff, continue to work with our Board of Education. We've had multiple sessions. It took a lot of time just having the administrative team make sense of it ourselves. So we're trying, folks, and so I'll leave it at that.
Thank you, Jen, for the question. Brandy is next in line with a question. Brandy L.
Hello, I was just wondering, as somebody who holds a school of choice voucher and whose daughter attended in Young Fives, with going into kindergarten, will we have to consider going to the school that we have to actually live in that we don't want to go to make room for the people who are actually in town, so that I can prepare ahead of time?
Good question, Brandy. So, you know, at the elementary school, our school of choice numbers are over 25% on a given year. So if all of our school of choice families were kept out, we would have a 25% reduction in everything at the elementary school. We certainly have the means to do better than that. We do not have to say goodbye to anybody. What may be difficult in some grades, and again, this would get communicated out once we know the information that comes in from all of you next week. What may be difficult is if you're an outside family trying to come in at this point. If you're already here with us, we're planning on you. If you know, if you are in the county and you're getting information from across the county and trying to make a decision in the next week or two and are asking to come in, we're going to be real mindful of what our class sizes are and how safe we can be in all of those spaces. And again, depending on the grade and depending on the numbers, it could be difficult to get into Schoolcraft at that point. So You do not have anything to worry about as you were a part of the system last year.
Thank you so much. That really eases a lot of worry.
Yes, understood. Danielle, your hand is up and next in line. Danielle L.
So I just have a question about the online and the hybrid learning. I know that you said that you can kind of go at your own pace, go as fast or as slow, but is there any mock schedule for either the elementary or the middle school that would be, you know, this is what they're learning, this is when they need to have it done by, and then kind of an idea of how to accomplish that?
So if I could speak for the middle school version and the students that we have had in Lincoln Learning and or Michigan Virtual, yes, there's automatic pacing suggestion that is included in the platform that students should be following if they are to complete the course in the semester or whatever the time frame might be. And so there is that aspect to it. But students can go faster. If they start going behind the pacing guide suggestion, that's where the instructors that are built into the program with KVIC or our own people will be touching base to see, hey, what can we do to help you get caught up so that you're able to complete this course in time and receive the credit that you're striving for. So it does allow some flexibility. Students can speed up or slow down. They could finish it really fast if they're really booking it out. But to answer your question, yes, the platform includes a pacing expectation in that course.
Okay. And what about elementary?
I'm sorry, Danielle, ask the question one more time.
So if we do the hybrid or the full online option, is there a kind of quasi schedule that we can follow with the kids that we have access to, or is it still just at your own pace?
So if you choose Schoolcraft Virtual at the elementary school, what we tried to be mindful of in the spring was that you may be an elementary parent with multiple kids trying to do online learning at the same time. And as the parent that's on the other side of that, trying to navigate it alongside your child, you can't listen in to 3 teachers leading instruction at the same time and then know what to do when it comes time to help them. So our goal in the spring was to stagger that elementary, synchronous instruction. We're going to try to do something similar with that this school year. If you are searching for the most flexibility and the least amount of structure, that is Lincoln Learning through Kalamazoo Valley, through KVIC. Our Schoolcraft one will have some structure. It's not built out yet, and I can't tell you like what Zoom hours on which days, but there will be a little more of a regular calendar to it.
Okay, and is the Zoom hours going to be just for like the teachers and the students asking questions, or is it going to be like a live Zoom educational instruction?
I think you could expect probably both, right? I think you could expect the teacher to be teaching you live, and then I also think you could expect an adult to just be there later, maybe on a different day even, to just check in and see how things are going.
Okay, thank you.
Teresa and Richard have their hand up. If you could unmute yourself and ask your question.
Good evening. Thank you for having this session. I actually think, Matt, you answered part of one of my questions. The first question is, we have one child who will be a freshman at the high school, and I know that we're dealing with time constraints. How are we going to integrate the freshmen that are incoming freshmen for the high school? And then the second part of my question, or second question I had, was if we were choosing a hybrid course for high school, what would that look like as far as, if there are cohorts on certain days with the revolving classes? And I think you addressed a piece of it with the schedule just a minute ago with the former individual who asked questions.
Yeah, great questions. We've got a tradition at the high school of the Freshman Academy, and I'm really proud to say that Lori Pelton has guided and directed that, and we certainly plan on making that as a, as a continued tradition in our building. What that looks like given the COVID conditions that we're under, we're still trying to tease that out to make that safe. But the Freshman Academy just isn't a start the year off thing and congratulations, we feel good in a day and good luck with the rest of your life. That's something that's a monthly commitment. And so just like everything that we've done from, learning to athletics, we've had to make some adjustments, but that's certainly one thing that's not going to evaporate with the current conditions that we're under. As far as the hybrid schedule is concerned, we're looking at a 2-day on, 3-day off schedule, depending on how we decide to kind of slice the alphabet and divide students up that select the hybrid choice. That could either be front end loaded with a Tuesday, Thursday, or I'm sorry, a Tuesday, Thursday route, or a Wednesday, Friday, depending on what day we select as the, everybody learns from home day at the high school. Students in the hybrid courses or selections would kind of be more or less tracked within other hybrid learners. So students that are going to be traditionally face-to-face would not have any class sections with hybrid kids. Does that kind of touch on the questions you're looking at there?
Part of it, I'm still I guess I want a little more clarity with the individual teachers with, for like math and science and, the additional required courses, English, they would have, it's not like elementary where they'll have one set educator. Will they still have 3 or 4 educators on those 2 designated days then?
Yeah, they most certainly would. So students in hybrid sections would rotate in amongst the building, at our normal bell schedule. So a lot of the teachers that students be in front of is based off of their teaching credential and what they're certified to teach. And, unlike elementary credentialing, we don't have someone that can do all subjects all the time. So all students in the hybrid sections would be rotating between classes and have up to 6 different teachers.
And then I have, I guess, one more additional question. I'm an educator as well. So I think of Children Plus, I have one child that does have a small educational plan. What resources I'm sure that we would still have resources available to us via the hybrid option?
Yeah, most definitely. You'd have all the complement of resources available to you. Human, electronic, and otherwise that any student who would be face-to-face is. We made a fantastic shift in the spring where we developed a system of student support with our student success coordinator, and our student behavior team, just to check in with students that may not have necessarily checked in or shown any academic progress throughout, a week. And we're able to, in a short amount of time, be able to make contact with them to see if they needed something for support. So academic supports to the, social emotional supports would also be available for any student, whether they're, online through KVIC or doing the hybrid or face-to-face.
And that's a great point that, and we've really put some additional resources here of late. We have a student advocate, like a success coach, in essence, in every building that has a social worker background. In addition, we hired last year a social worker. So from not a lot of support to having 4 people, look, these, again, kids are coming in with some challenges and we want to support them and these times create this as well. And so we will be addressing the social emotional component. So you didn't see that in our presentation, but we really strive to do that. Pre-COVID, but even more so April on, and trying to check in with our kids on a weekly basis, and then also our adults. So we checked in weekly with our staff as well. So that's critically important because again, if the mind's not right and other needs aren't there, good luck with learning. So thanks for bringing that topic up. Any other questions? Again, I think we're kind of at a point here that
you've got.
Do we have a few?
Yeah, Jen Gottschalk.
Oh, Miss Jen.
So I just want to reiterate something that we stated earlier, that everything that you've seen out here tonight does say proposed on it, and just to hang with us while we get through these next couple of weeks to figure things out. And if there's a question you had tonight, because I was trying to monitor the chat as well, and it was going so fast. I know some people's questions didn't get answered. The 3 building principals, reach out to them, reach out to Dr. Stitt, and ask your questions. Don't let any questions go unanswered through this process. So again, I just want to thank everybody and all of our team and our teachers for everything that you guys have done the last couple of weeks. It's been extremely stressful and a lot of long hours for a lot of us. If you can just hang in there with us, we would greatly appreciate it.
You were behind me?
A moment ago, there was one more hand raised, and happy to take on that last question if it was still there. I just didn't. They've since lowered it, so I'm not sure who that was. But Doctor said that at this point there are no more hands. If you'd like to close things.
I think Jen really did a nice job. I too, on behalf of the district, our board, our admin team, and our staff, we just like to thank you for choosing us as the district of choice for your kiddos. Please note that while you're the biological child, in most cases, we are the parents as well, and we don't take that lightly. So I always say I have 2 biological kids, but we almost have 1,100 kids that are serving in our district. So we care and love our kids. We care and love our parents, our community, and our staff. And we really, in order to make this plan, this proposed plan a go, we need to see the similar numbers as we had in the preliminary data. And we without a doubt, will be following social distancing, masking, and hygiene. So please join us in making this a great year, and with all challenges become opportunities. So thank you all. I wish you all the best. God bless. And let's continue to pray for this solving this COVID piece, and pray for our district and our schools. So thank you so much. Be well. We will record this and also send it out, and then all the links and what have you to help you make the informed decision. Be well.
Thank you, everybody.